Hello, I am Lorraine Colte Vasquez from AARP. As the number of older Hispanics in the U.S. grows, we are deeply committed to understanding and addressing the needs of this population. And that's why the documentary you're about to watch is so important. This documentary leads the way to finding solutions that make sense when it comes to healthcare disparities and other obstacles. We realize that Hispanics face barriers in healthcare that are distinctive to our community. These include language, the ability to speak to a doctor or a hospital worker where they do not speak Spanish, the lack of access to important tests such as cholesterol and diabetes. As a Latina and a person who cares about the healthcare needs of those in my community, this documentary shines a light on the critical healthcare disparities faced by many. AARP wants you, every person 50 and above, to live life to the fullest. We are dedicated to the vision of a society in which everyone lives their life with dignity and purpose. AARP is delighted to work with NJN Public Television to bring attention to the issues that are of great importance to the Latino community.
The following program is dedicated to the memory of Omaira Ramirez, who went to sleep, never woke up, and no one knows why. And to Joaquin Rivera, who suffered a heart attack, went to a hospital emergency room, waited over an hour without treatment, and then died.
Major funding for Salud Sin Barreras, Health Without Barriers, is provided by AARP. AARP, a nonprofit, nonpartisan social welfare organization that helps people 50 plus have independence, choice, and control.
Saludos. Welcome. I'm John Quinones. Healthcare disparities experienced by the Latino community are rarely addressed. In this compelling documentary, we'll shine a light on this critical issue with a focus on cultural and personal barriers that create roadblocks to quality health care. Let's begin this informative journey of revealing personal accounts and advice from experts with a typical display of cultural pride symbolized by Hispanic parades.
Across the nation, the rise in Latino festivals and parades is indicative of the largest, fastest growing, and youngest ethnic group in the United States. By the year 2050, an estimated 102 million Hispanics, about 24% of the U.S. population, will call America home. Latinos are renowned for their jubilant emotions, colorful costumes, vibrant dances, and traditional smiles. However, just beneath the surface of this community, there is a different picture, one of untold health problems and healthcare disparities that are taking their toll on the Hispanic population living right here in America. To demonstrate the health status of the Latino community, we polled the newly elected queens and princesses of the Puerto Rican parade in Jersey City, New Jersey. When we asked how many of them had family members who were diabetic, 4 of the 7 young ladies raised their hands. When we asked again how many family members were diagnosed with cancer, 6 out of the 7 raised their hands.
I know that my cousin Tommy, he has cancer, but it's sad because he died. My aunt has breast cancer, and really, it hurts me to see her in her house sometimes, but it's really sad because she had to go to the hospital and they had to check her and stuff, and she definitely has it, so I'm really sad that she has it.
It's really sad because just because you can't pay for a copay to go to the doctors doesn't mean that your health has to be affected by that. It's really sad. I just want healthcare to be more affordable towards all families.
According to the American Cancer Society, 1 in 2 Hispanic men and 1 out of 3 Hispanic women will develop cancer during their lifetime. Even the great boxing legend Oscar de la Hoya lost his mother to cancer when he was a teenager.
My mother passed away from breast cancer right before the Olympic Games in 1991, and her last message to me was go ahead and bring that gold medal back. So obviously it's still in my heart.
Oscar's concern over the rising number of cancer victims in the Latino population led him to build a cancer medical center in Los Angeles to honor his mother.
He opened up the Cecilia de la Hoya Cancer Center, where we impact a lot of lives. And it most recently hit me and touched me when recently several women came up to me crying, telling me how I saved their life.
Oscar found a way to deal with his mother's death. But for the children we met earlier, death can be difficult to understand and accept. They took us by surprise when we asked the question, what was the biggest healthcare barrier they had experienced in their young lives?
As a kid, the biggest problem for me is when I want to see my grandfather in the hospital. It hurts me because everybody who's too little to see anybody in their family who's sick or can die, it makes me feel sad because when my mom told me my grandfather already planned his funeral before he was even dead, it made me really sad.
I remember the age to go see my grandfather when he was really sick was 16, and I felt it was sad because I saw that my mom would be sad, my dad and my brother. They'd be able to go see him, but I wouldn't. And I had to stay there in the waiting room, and it wasn't fair.
You never get to see the person that you really care for and who warms your heart. And my grandfather died too.
I love making people smile. That can make somebody feel a lot better than medication. When you tell them you love them, when you support them, and when you care for them, and when you show that you love them a lot, that affection, it could make them happy, and you don't know, maybe they could feel a lot better.
We do need to break this barrier of just thinking that because this is a child, that their emotions are not important. So for the mental health of the child, of everyone involved, and whatever is going to happen in the future, because see, we don't know. These are many of the traumas that later on that child might be walking around as a teenager or even an adult, where in back of their mind they were not able to say goodbye. If you look at one child, that she expressed the need to say, I love you, Grandpa, I love you, Grandma. She even said it, it's not all medicine that does it. So this is how important it is if they can say medicine is important, but my love is more important. So this barrier or these occurrences or however we're handling, we do need to break this barrier.
They can release all this stress, they can release the sadness, and they can do different things that make them happy, like sport, participation in music, different activities, very important.
Armando Roman, fire director for a Jersey City company proclaimed as national heroes of 9/11, is the president of the parade.
And we use that as a vehicle, the parade, a time of celebration where we can, by the same token, not only celebrate, but educate our community with the horrors of this disease. And indicative of that is like when my wife came down with breast cancer. And I remember the first day that she mentioned it to me, I said, it's nothing. I said, it's a little lump. I said, maybe a little cyst or whatever the case is. Go, yeah, put something on it. Don't worry about it, you know. And she said, well, you know what? I'm going to go get it checked out. And certainly later on, as we went in and she had her physical and breast exam, it turned out that it was cancer.
Because of his personal experience with cancer, he now takes time to educate the community about the importance of quality health care.
Many of us tend to procrastinate, at least male compared to females. Females are a little more prone to going to get checked, you know, for whatever it is that's ailing them. We tend to, with the machoism, we could take the pain or whatever the case is, and we procrastinate going to the hospital. When you get to a certain age, you're supposed to get your prostate, you're supposed to get your colon checked. It almost feels like a violation of your masculinity to be checked by someone, and obviously that is so important for men.
We also know from looking at national statistics that Latina women have the higher prevalence of cervical cancer, along with Vietnamese women, actually. Vietnamese women have very, very high rates of cervical cancer. And then you have all of this new knowledge that we acquire with regards to what causes cervical cancer. Remember, cancer is not traditionally known to be caused by any infectious disease. Yet we know now that cervical cancer, the main reason for cervical cancer, not the only, but the main, is HPV. We know that the human papilloma virus, right? So we made an enormous amount of effort to now have a vaccine that could prevent this. But think about that concept for our community. Number one, cervical cancer shows up early and usually late in life. When it shows up late in life, women get asked, about sexually transmitted diseases. They never had any of that. Or they would say to you, how can I get that? I haven't had sex for over 30 years. And so all of this knowledge gap that we have now that we need to deal with is to help women understand that even though they're not sexually active, they need to have pap smears and have screening for cervical cancer.
Routine checkups and preventative testing are key elements that provide better access to quality health care and a healthier lifestyle for Latinos.
We were very fortunate to be part of a national program that talks about facilitation of services to the community. So this is funded under the Center for Medicare and Medicaid Services. It's a cancer prevention and treatment demonstration program. So it's facilitating services through patient navigation. And the concept of patient navigation is taking someone from point A to B to C to accomplish the care that they need.
You call, they take care of you, and locate the best doctor for you.
The importance here is to eliminate barriers and worry about the patient. Not patch up a broken system, it's really focusing on the patient that's important. Our patients definitely need the help.
I had a difficult illness. Twice I had cancer.
But according to Dr. Natalie Pereira, cancer is not the number one cause of death for Latinos.
The main cause of death first is cardiovascular disease. Second is cancer.
At a 2010 health conference sponsored by the American Heart Association, an amazing revelation was made about heart disease and Hispanic women.
Our heart is 10 years older compared with the heart of a white person or Caucasian person.
Essentially what this means is that a 19-year-old Latina is really 29 in heart years. This finding indicates the need for more clinical trials and earlier testing to determine why this aging process is taking place in many Latinas in comparison to non-Hispanic females.
We don't want you coming into our hospitals or any hospital having a heart attack at the age of 35 or 40.
The prevalence of Latinas with heart disease at a younger age is a health problem that can be studied by scientists looking for underlying causes and prevention.
It breaks barriers by getting the information out there because we cannot be ignorant anymore. We need to embrace the information, learn from it, and make internal changes for ourselves and become, more proactive to ourselves.
However, when you take a closer look at the healthcare system, the real problem surrounding health issues and ethnicity is the disparity of access to quality health care that many Latinos and underserved communities encounter.
There are structural barriers, the system, transportation.
Some primary care hospitals in the Latino community, which were the symbols of pride for previous generations, are no longer operational. Many have had to close their doors, or were torn down, or turned into condos. 25 hospitals have closed down in New Jersey since 1992, and 6 are on the endangered list. This means emergency room patients, the sick, the elderly, and women in need of prenatal care have to travel away from their neighborhoods to unfamiliar medical institutions for help.
I literally don't like it because in emergency, they won't take care of her as fast as we expected to because of her condition. They will understand it. They don't understand it. They tell me to wait.
When Maria Vizcarrondo de Soto learned that St. James Hospital in Newark was closing, she joined more than 700 protesters in an effort to keep the hospital open. While they were not successful in keeping the entire facility open, they did manage to bring an innovative idea to life.
Having this prenatal clinic here in this area will be very beneficial for especially the women in this clinic because they get the proper nourishment for the babies and for themselves.
Last year we served approximately 25,000 clients. This is where we're providing prenatal services, but we are at the St. James campus. This as a result of really a collaboration between the City of Newark, Maria Viscaranda, who played a major role, as well as the state.
Hopefully this will be a model for other urban communities to be able to look at an alternative and not to see the end of the tunnel being the closing of the hospital, but to see a light beyond that tunnel to say, what are we going to develop next to still meet that critical need in our community?
Lack of federal funding, overcrowded emergency rooms, rising hospital costs, reduction in primary care doctors through specialization, malpractice suits, and a decrease in the number of students entering medical school. They have all contributed to the dismantling of neighborhood hospitals.
We're at a point now where we're borrowing money from China, the federal government, to pay today's healthcare bills. It's tests and procedures that are not necessary because they were just done by another physician, and the new physician doesn't have access to them. What happens when we have overuse of unnecessary medical care, there isn't enough money then to pay for the care that everybody else needs. And that's one of the reasons why healthcare is so expensive.
For many Latinos, one of the biggest healthcare barriers is the fear of hospitals and doctors in general. Latinos have experienced difficulties communicating with doctors and nurses. Stories of Latinos unable to convey their symptoms because of a language barrier, being misdiagnosed, and sometimes treated with disrespect by hospital personnel have created an atmosphere of distrust.
For example, her daughter had a terrible toothache, and they gave her an appointment for a month later.
They told me I had to be there at 6 a.m. If I was not one of the 6 people in line, they would not attend to me.
Unfortunately, many Latinos who distrust hospitals and doctors or are uninsured turn for medical advice to individuals not authorized to practice medicine. These so-called doctors may speak their language, but at a price. They make an underground living conducting illegal backroom operations that often end in tragedy.
They can end up in an emergency room, and worse than that, they can end up dead.
The people that fall prey to that put not just their own health in danger, but the health of their entire family.
This is a very important problem that needs to be addressed, and our public needs to be advised that there are a lot of people taking advantage.
And we view that as a statewide problem and also a nationwide problem.
No sabemos qué herramientas usan, qué productos utilizan para la sanación.
We don't know the type of instruments they use or what products are being used as antiseptics. I don't want a family member or my countrymen to get infected with someone else's disease. But unfortunately, many of us have to turn to them because no one will treat you without insurance.
One of the ways to break down healthcare barriers that exist in underserved communities is universal health insurance. For that reason, Latinos across the nation were hoping that President Obama's health reform plan would improve their access to quality health care.
One of the important things is that because of the Affordable Care Act, close to 9 to 10 million Latinos will be able to afford health coverage that right now are uninsured. And there are many provisions in terms of prevention, in terms of measuring the health care of Latinos that was not available before. When you measure, you are able to assess and you're able to provide funding. And these are pieces that are very important as a health care reform implementation goes forward.
President Obama's health reform plan may take years to develop. One of the many concerns is the number of uninsured patients who will require service from an unprepared medical system.
You know, we talk about healthcare reform, bringing in by 2014 is 31 million people will be insured. A big majority of them will be Latinos. And, you know, where are they going to go?
We talk about access to care and how Latinos are afraid of going to the dentist or going to the physician. But part of our problem is because we don't have a lot of people like us in these professions.
For the Latino community, recruiting more Hispanic students to study medicine may resolve some healthcare barriers.
But it's not enough to wait till they come into the medical school. So our outreach extends to individuals who are much younger. The medical school overall, actually, its earliest program begins at 6th grade, and have been able to graduate, since 91, because I didn't want to do the years before, a little over 300 Latino physicians. But it's with the passion that we know that diversity matters and that inclusion matters.
As we look for ways to overcome the healthcare barriers that prevent many Latinos access to quality healthcare, one of the most underserved groups can no longer wait in silence.
They're like, oh, they're disabled. They're not going to know. They won't know, and they won't fight it because they're too scared to fight, and that's not right. No. We're fighting it now. We're putting a stop to it now. There should be no barriers for us. At this time of age, they shouldn't be the way it is now.
Believe it or not, Destiny is the future of this organization, basically of all disabled and everything. She's the future. She's the one that could make a change. To show everybody what life is really all about, what you could do.
She's going to show people that nothing is stopping her.
You don't have to be dependent on nobody.
Chair, you don't have to depend on anybody but yourself. And it's always great to help somebody out.
Becoming an activist in the quest for better health care, compassion, and treatment is another important key to breaking down barriers. Meet Diane Reportella. She suffers from ALS, known as Lou Gehrig's disease, and is restricted to her bed. Before ALS, she used to raise funds for cancer research.
And I was Woman of the Year for 2003, 2002 for the Leukemia and Lymphoma Society.
Diane made national headlines when she testified before the New Jersey State Assembly, fighting for the legal use of medicinal marijuana by critically ill patients because it eases their pain and stimulates appetite. Her mission was complete on January 11, 2010, when New Jersey became the 14th state to allow access to medicinal marijuana.
Everybody who's sick has a different need. So we really shouldn't put barriers on the health issue.
Today's poor economy is another barrier to quality health care. There have been severe cutbacks in funding for community-based programs like the Hispanic Family Center in Camden, New Jersey. But through the efforts of its dedicated staff, the Family Center continues to promote good health practices in the community.
It's very important here in Camden County, and specifically in Camden City. We have one of the highest HIV rates in the state of New Jersey. We go out into the community and we approach them directly so that we can reduce that number in the next 5 years.
A huge problem with asthma. It's one of the main reasons for school absenteeism in children, asthma in children. And we do offer an asthma prevention program in Spanish, in which we go into the homes and help individuals identify their own environmental triggers.
Community organizations like Camden's Hispanic Family Center are vital in the effort to address critical health issues facing Latinos. These organizations help educate and provide information for the Latino community. To understand Latino immigration and lifestyle patterns, there is a need for studies like those conducted at Princeton University. Dr. Patricia Fernandez Kelly of the Department of Sociology and Office of Population Research explains.
We looked at institutions of medical care and healthcare delivery services in 3 locations which are noted for their immigration population: the San Diego area, Miami-Dade County in Florida, and the Trenton, Central New Jersey area. We found, for example, cases of parents taking their children to clinics or to hospitals and not being able to explain what the symptoms are, and being given pills, going back home and watching their child die of acute appendicitis, stuff like that. So language is an important barrier.
Health without barriers, that's the positive message we have to keep sending out.
From Hollywood to New York, Latino celebrities are speaking out about ways Latinos can overcome healthcare barriers.
You do a little exercise, even if it's walking, because right now we do have a serious problem.
As a mother, I've always been very conscious of the food that I put on my table. While I am very, very dedicated to preserving the traditions of our Latin food, I also try to modify recipes such that they are healthy for us. Gone are the days when our abuelas used to fry with manteca, with pork lard. It's just as tasty and much more heart healthy to use olive oil and vegetable oil.
Latinos have incredible strength and a loving heart. We cannot allow any barriers or conditions to stop our growth. You will achieve what you are searching for.
You gotta be strong, you gotta stay focused, and you'll be able to achieve whatever you want. I'm very familiar with battling, health issues because my son battled many health issues.
Laura Posada, wife of Jorge Posada, catcher for the New York Yankees, knows firsthand the difficulties of navigating the healthcare system. When their baby boy was diagnosed with craniosynostosis that affects the growth of the skull, the Posadas had the means to receive the best medical attention. Early diagnosis is key to alleviating this disorder.
We stayed together, we supported him, we fought, and now we continue fighting for other families that didn't have the financial means that we have.
Health fairs conducted in the Latino community are extremely important for access to free testing and medical information. The participation of hospitals in these events does help to break down the barrier of distrust and fear of institutions that exists in underserved communities. These events allow medical professionals to evaluate and examine the entire family, form relationships with the community, and give health advice to those most in need.
I think if you have a chance, to benefit the community and to make a change for the better, you should definitely do so.
If each of us makes an effort to eat healthier, exercise, and get regular checkups, maybe our future generations can live longer and more productive lives. For now, I leave you with a promise made by 7 young ladies that should serve as an example for all of us to follow.
Dedicate a lot of my time helping other people other than my family, like little kids. I do the walks and stuff. And I think it's really good to see other people helping out the community too.
Yeah, I think it's good because I want to make the world a better place for all of us.
Major funding for Salud Sin Barreras, Health Without Barriers, is provided by AARP. AARP, a nonprofit, nonpartisan social welfare organization that helps people 50 plus have independence, choice, and control.
Salud Sin Barreras, Health Without Barriers is now available on DVD. Simply call 877-656-8433 or go to njnstore.org.